Welcome to the tutorial video for Chemical Risk Calculator's Color Additive module. My name is Dave Saylor, and I am a research materials engineer in the Office of Science and Engineering Laboratories, which is within the Center for Devices and Radiological Health at the U.S. Food and Drug Administration. The Chemical Risk Calculators, or CRIS for short, are a collection of web-based applications intended to facilitate the use of mass transport models to derive estimates for systemic patient exposure to certain added chemicals in medical devices. These estimates can be used to inform toxicological risk assessments, or TRAs, that can aid in the biocompatibility evaluation of medical devices per ISO 10993 Part 1. The color additive module of CRIS that we'll be discussing today enables users to conduct screening-level TRAs of polymeric medical device components that contain color additives. These assessments enable device manufacturers to de-risk the selection of color additive formulations for use in medical devices by providing instantaneous feedback early in the product development process on whether the presence of color additives and any associated additives and impurities might require additional justification or testing to demonstrate acceptable biological risk. Alternatively, manufacturers may choose to adjust the intended formulation and rerun the calculator to determine the possible acceptability of a revised formulation before design freeze. Further, the tool can be used to reduce the amount of testing needed, for example, following a supplier or manufacturing change related to the color additive in a medical device, or for product lines that are identical except for the presence and type of color additives. It is important to note, however, that because the tool only addresses color additive related compounds, a favorable outcome does not imply acceptable biological risk for the final finished form of a medical device. Also, because the safety limits used within the tool have only been established for systemic biocompatibility endpoints, the tool cannot address local endpoints such as cytotoxicity, sensitization, irritation, hemocompatibility, material-mediated pyrogenicity, or implantation. The color additive module of CRIS is freely available online at the link on your screen and has been qualified as a medical device development tool, or MDDT. MDDT qualification means that assessments provided by the tool will be accepted by CDRH when they're used to support a medical device submission, as long as the tool is used within the qualified context of use. More information on the qualified context of use for the CRIS color additive tool can be found on the MDDT website shown on your screen. In this tutorial video, I'll provide a demonstration of how the tool can be applied in practice by considering a hypothetical use case, which considers the addition of a new color master batch formulation to an existing medical device. So let's get started. On the right-hand side of the screen is the landing page for the Chemical Risk Calculator's Color Additive module. You can see there are 4 different categories of inputs that the user must provide to use the tool. This includes information about the color additive, the polymer matrix, the medical device itself, as well as a list of underlying assumptions for the model used by CRIS. To illustrate how to enter a color additive formulation into the tool, I have an example shown on the left of a color master batch formulation that we will use for this demonstration. In this hypothetical color master batch formulation, we have 4 components. Those are zinc oxide, solvent red 135, ethylene bisteramide, and a carrier resin. For this demonstration, we'll consider that the master batch components are 99% pure. It is also important to note that zinc oxide will be present as insoluble particles, and the exposure model used by CRIS will treat them as such. I also want to point out that the carrier resin will not be a leaching concern due to its high molecular weight, and it's effectively integrated into the polymer matrix. In addition to the color master batch formulation, we also need information about the device. So again, for this demonstration, we're going to assume that our medical device is a high-density polyethylene, or HDPE disc, that's loaded with 1% of the color master batch. This disc will have a component mass of 3 grams and a density of 0.95 grams per centimeter cubed, with a surface area of 12.6 centimeters squared. In the table at the bottom of the slide, I'm showing the components of the color additive formulation and their loading within this hypothetical device. For example, the zinc oxide is loaded in at a total of 4.5 milligrams, the solvent red 135 at 3 milligrams, and the ethylene bisteramide at 1.5 milligrams. I also want to point out that within the tool there are safety limits upon which we're comparing the exposure calculations to. For certain color additives such as zinc oxide, we have derived chemical specific safety limits, in this case 2.5 milligrams per day. However, for the other compounds, we do not have a chemical specific safety limit, so we will rely on a comparison to the threshold of toxicological concern, or TTC value. So based on this information, we can now show how to use the tool to evaluate this color additive formulation. So I'm going to start with the zinc oxide. So to enter the zinc oxide into the tool, we can, from the pull down menu, select zinc oxide. You can see that the molecular weight field is grayed out because we're treating that as an insoluble particle. We have 4.5 milligrams of zinc oxide, and our impurity levels are no greater than 1%. The polymer matrix is high density polyethylene with a mass of 3 grams and a density of 0.95 grams per centimeter cubed. The surface area is 12.6 centimeters squared, and for this initial assessment, we're going to assume that this device is intended for limited contact of no greater than 1 hour. Next, we have to confirm that we comply with the underlying assumptions of the model. In this info box here are detailed instructions on how to confirm that your specific device and formulation comply to the underlying exposure model. For now, we're going to assume that we've reviewed this information and can confirm that our specific device complies with all 5 assumptions. So I'm just going to click those boxes. And that is the extent of the information that we need to enter to evaluate our compound. So now I can hit Estimate Exposure, and the tool will produce a report, which I'm showing on the right-hand side of the page again. At the top of this report is a summary of the exposure calculation. In this case, a worst-case exposure, single-day exposure for zinc oxide was predicted not to exceed about 1.4 micrograms. There are some details about the model that's used to provide this exposure estimate, as well as some of the parameters used in that model based on the user input. In the next section, there's a summary of the assumptions, the fact that we've actually complied with the assumptions. And in the section after that, provides the output of the screening level toxicological risk assessment. In this particular case, the estimated exposure was far less than the tolerable exposure or safety limit of 2.5 milligrams per day, resulting in a margin of safety, or MOS, of 1800. Because this MOS value is significantly greater than 1, there is no further analysis that would be needed for systemic biocompatibility endpoints with respect to the zinc oxide in this hypothetical medical device. The tool also evaluates the presence of impurities associated with that zinc oxide. In this case, it compares the total amount of impurities to the relevant TTC value, which resulted in a margin of safety again greater than 1. Therefore, no further analysis would be required for the impact of impurities on systemic biocompatibility endpoints. So that is how we evaluated the zinc oxide. We now need to go back and evaluate the other 2 compounds within our color additive formulation. So I will just hit the back button, and we can do the same process for the solvent red 135. In this case, solvent red isn't explicitly listed in the pull-down menu, so we must choose Other Non-Metal Oxide Color Additive. Then I can enter the chemical name, solvent red 135, the molecular weight of 408.1, the amount, which is 3 milligrams, and everything else is the same that we entered for the zinc oxide. So I can again go down, click the Estimate Exposure button, and I get a second report that's associated with the solvent red. In this case, again, we can see that our margin of safety is well in excess of 1. Therefore, we can rule out solvent red as a potential systemic tox concern. And the same is true for the impurities associated with the solvent red 135. I can now hit back, and we can evaluate the final compound in our color additive formulation, ethylene bistyramide, which isn't a color additive but a manufacturing aid. So in this case, we have to select Other Color Additive Associated Compound. I can then enter the chemical name again, which is ethylene bistyramide, the molecular weight of 593.04, the amount, which is 1.5 milligrams, and once again, everything else is identical. And when we click Estimate Exposure again, we get an evaluation for the ethylene bistyramide. And again, we can see that the margin of safety is greater than 1, so no further analysis would be needed either for this compound or the impurities associated with this compound. So we can look at these results in summary on the left-hand side of the screen, and we can see, assuming this device was intended for limited contact, we've been able to rule out not only all the components associated with the color additive formulation, but also their impurities as potential systemic tox concerns. However, if we assume that this device was intended for a long-term contact application, we can see that in this case, only the zinc oxide itself has a margin of safety greater than 1. All of the other components, as well as the impurity, have margins of safety less than 1. Therefore, we could not rule them out using CRIS as a systemic tox concern. However, one can use parts of CRIS in their toxicological risk assessment. As an example, for the solvent red 135, we note that the predicted exposure provided by the tool was about 2 orders of magnitude less than the total loading. One could use this information along with an independently derived tolerable exposure value in an independent tox risk assessment for these additional compounds. Also, for the impurities, if chemical-specific information, including the identity and amounts of the impurities associated with each of these compounds, is known, that information can also be used as part of an independent risk assessment. Thank you. That concludes the tutorial video for the CRIS Color Additive module. I hope that you found this information helpful, and thank you for watching.